Thank you, Jill. Our next speaker is Dr. Bruce Amundson, who is the President of Washington Physicians for Social Responsibility. Thank you.
Thank you, Alec. So we're pleased to be here, and I'd like to address some of the health issues that these youth are trying to head off. Environmental, political, and health leaders in Washington are making major efforts to reduce our state's greenhouse gas emissions. We at WPSR deeply appreciate the relentless leadership of Governor Inslee, the greenest governor in the U.S., to try to address our overheating planet. But we agree that the Department of Ecology's proposed clean air rule is not sufficient to confront the looming catastrophe of a warming planet. Climate change is already occurring and producing severe health effects on the natural world and on human health. Although uncertainties remain regarding health risks, failure to take prompt action, given our current knowledge, would be an act of injustice to everybody, especially children. Here's why. It's quite simple. According to the World Health Organization, more than 88% of the existing burden of disease attributable to climate change occurs in children younger than 5. Children represent a uniquely vulnerable group. Let's look at some of the major health risks from climate change, and especially how they impact children. Extreme weather events, severe storms, floods, and wildfires have increased markedly over the last 40 years. These extreme events directly threaten all those exposed with injury and death. But they pose special risks to children. Extreme weather events place children at greater risk of injury, but kids also experience frequent loss of their parents and the terror of separation from their caregivers. They also faced a high risk of mental health problems, such as depression and post-traumatic stress disorder. Further, major weather disasters cause irrevocable harm to children through devastation of their homes, their schools, and their neighborhoods, all of which can impact both the physical and cognitive development of kids. Then we have heat waves. Children suffer directly from the increased severity of heat waves. There's an increase in child morbidity and mortality during extreme heat events, especially for kids under 1 year of age. Pay attention to this. There is a greater than 90% chance that by the end of the 21st century, average summer temperatures will exceed the highest temperatures ever recorded in many regions of the world. Average temperatures will be the highest, greatly putting families and kids at risk. The eastern part of our state, already experiencing very high temperatures, will clearly be impacted. A secondary effect of rising temperatures is reduced air quality. Our air quality is reduced because of greater ozone concentrations at ground level, higher pollen counts, longer allergy seasons, and smoke from wildfires, which has already become a health problem for kids in Washington. All of these aggravate respiratory diseases, and especially asthma in children. Washington commends the children of Washington who are leading this campaign. Their advocacy could improve health prospects for children all across the globe, kids who are being put at risk for other serious problems associated with global warming. Problems such as higher burdens of diarrheal disease, a major killer in the tropics, reduced food availability from altered agricultural production, and reduced access to clean and safe drinking water. So to that extent, Washington's children have become champions for kids across the planet. We are honored to put our support behind this initiative to pass legislation that will move our state towards science-based levels of carbon emission. Physicians expect our elected officials to respect science. Failure to accept the science behind our overheating planet has become a moral issue, not just a political one. Thank you.